Good morning and welcome to the Oversight and Investigation Subcommittee hearing of Energy and Commerce titled Counterfeit Drugs, Fighting Illegal Supply Chains. This hearing could also be titled Poison Pills in Your Medicine Cabinet or Counterfeiters Deliver Deadly Drugs. And it states it's to the fact that we need to examine the growing problem of counterfeit drugs in our country. Last year, Congress took an important first step against this threat by enacting the new track and trace law known as the Drug Quality and Security Act of 2013. This new law will secure the legitimate distribution channels and when implemented will solve the legal supply chain part of the counterfeit drug problem. However, many Americans purchase medicines through illegal supply chains, such as rogue internet pharmacies and other black markets. It is that part of the counterfeit drug threat that we address today. This hearing focuses on the illegal supply chains of counterfeit drugs and on efforts to deter and disrupt these illegal supply chains. The legitimate U.S. drug supply is safe, but counterfeit drugs from illegal sources are a significant and growing global public health threat, potentially causing treatment failure or death and contributing to increased antimicrobial resistance. The policy of the United States government is not to wait for a full-blown crisis before taking appropriate action. Drug counterfeiters do not just steal intellectual property, they recklessly and intentionally endanger human lives. They sell counterfeits that do not contain active ingredients and provide no treatment benefit to the patient. Thus, a child suffering from malaria who takes a fake anti-malaria drug might die within 48 hours because the malaria remains untreated. The counterfeiters sell fakes that may contain incorrect ingredients, improper dosages, hazardous or poisonous ingredients. For example, an emergency room doctor from Texas in 2011 took a counterfeit weight loss drug he bought from an online pharmacy. The drug was contaminated with a controlled substance and he suffered a stroke. The counterfeiters sell drugs with risks for harmful side effects or allergic reactions. For example, in 2007 and 2008, dozens of heart surgery and kidney dialysis patients in the United States suffered unexpected allergic-like reactions and several lost their lives due to intentionally contaminated heparin imported from China that had entered the Chinese heparin supply before purporting to be pure heparin. The counterfeiters do not care about the patients who are hurt. One counterfeiter, Richard Taylor, was notified in May 2011 that two patients who had been on a counterfeit cancer drug he had distributed had started to shake in the middle of being transfused and had to be disconnected from treatment. However, the penalties for drug counterfeiters under the Federal Food, Drug, and Cosmetic Act have not been updated since 1938. As the FDA commissioner has said, there is a steeper penalty for counterfeiting a designer purse under the Federal Criminal Code than a drug product under current FDA law. Drug counterfeiting is highly profitable, and the criminals only face the maximum penalties under the FDA law of $10,000 or 3 years in prison. In contrast, penalties for trafficking narcotics can have prison sentences up to life and fines in the millions of dollars. There's one estimate that the return on counterfeit drugs may be 10 times greater than that of the sale of illegal narcotics. Now, experts tell us that the counterfeit drug problem has worsened over the last decade, and the reason for this disturbing trend include increasing opportunities created by larger, more complex supply chains, more customers reachable through the internet, more cases where the counterfeiting crimes occur in several countries, making enforcement more difficult, and the expansion of counterfeiting from so-called lifestyle drugs into therapeutic medicines used to treat cancer, heart disease, or other illnesses. The illegal supply chains are numerous and global. Rogue internet pharmacies are now proliferating. There are believed to be about 35,000 to 50,000 active online sellers, 97% of which do not comply with U.S. laws, according to one review of over 10,000 internet sites. One report estimated that 1 in 6 Americans, 36 million people, have bought medicines online without a valid prescription. These illegal pharmacy operations are big business, with the largest ones reportedly making $1 to $2.5 million of sales each month. The sheer volume of imported drugs in the U.S. is overwhelming, and opportunities have never been greater for foreign unapproved drugs to get into the United States. Nearly 40% of drugs taken by Americans are made overseas, and 80% of the active ingredients are imported from about 3,800 foreign manufacturers in more than 150 countries. According to a 2011 FDA report, the number of foreign drug suppliers has doubled in the last 7 years. The Government Accountability Office has found FDA is only able to inspect foreign drug plants every 9 years, while FDA inspects domestic drug manufacturers every 2 years. Well, the subcommittee will also examine other illegal supply chains, such as medical clinics and doctors who purchase drugs from illegal sources, business-to-business networks, and smugglers bringing unapproved or counterfeit drugs from Mexico into the U.S. I welcome all of today's outstanding witnesses. I look forward to your testimony, and now I turn to recognize my friend and ranking member, Ms. DeGette of Colorado.